Over 30 million Americans live with type 2 diabetes in the United States, with approximately 6 million requiring insulin, of which 2.5 million are using multiple daily injections. Despite advances in medical therapy over the past 20 years, there's been no significant change in the percentage of adults with type 2 diabetes achieving recommended glucose level targets. This underscores the ongoing challenges in diabetes management and the need for more effective strategies to improve patient outcomes. Today, I have Dr. Trang Lai, Chief Medical Officer at Insulin Corporation, joining us. How are you today?
I'm great, thanks, James. Thanks for having me.
Thank you for joining us. So, what has been the challenge for the millions of Americans managing type 2 diabetes? And I have two brothers who have type 2.
Yeah, well, it's then you must know that it's an incredibly challenging condition that advances over time. So as you mentioned, there are millions of people living with type 2 diabetes who take insulin as injections, and 2.5 million who take multiple daily injections. And what we mean by that is, having to take an insulin injection before breakfast, lunch, and dinner. And over the course of a year, that's 1,700 injections, a lot of injections. And what ends up happening is that people don't remember to take all of those injections and they run their blood glucose levels high. And this can lead to very serious complications. So there are companies such as ours that are working on better ways to treat type 2 diabetes.
Now, what can you tell us about the latest study presented that many are calling a breakthrough?
Yeah, so this study was just presented at the American Diabetes Association in June this year. And it was the first study to show that Omnipod 5, which is a tubeless automated insulin delivery system, was effective and worked really well for people living with type 2 diabetes. After 3 months of using the product, people saw a large reduction in their A1C, an improvement of their time in range. So, an additional 5 hours a day of spending time in the healthy glucose range. And then on top of that, which is probably the most important thing, is that there was a reduction in their diabetes distress. So all of that to say, this is technology that is going to help people feel better and live healthier and longer lives.
Now, how does the automated insulin delivery AID system work?
This AID system is composed of the Omnipod pump, and this is an insulin pump that you wear on your body. It's waterproof, it's discreet, and it holds about 200 units of insulin that can be delivered up to 3 days. So it's about if you can imagine, the shape of half a boiled egg that people wear on their body. And instead of having to give injections via a pen or syringe, people can deliver a insulin bolus from an app from their smartphone. So you can imagine, just like sending a text, people can give their insulin very easily and conveniently.
So, what's the advantage of this AID system?
The biggest advantage, I'd say, James, is, people don't need to give injections anymore. And that is really incredible. And I'd also say, all of those clinical results we talked about. So those improvement is what's going to help people live healthier lives. And then, the usability of the system, it's so simple and easy to use. People put on a CGM and their pod and then off they go. Just so easy to manage. And what we know is that, the easiest therapies to use are the ones that people are going to use for longer.
So, what is the final takeaway you'd like our audience to remember?
Yeah, what I'd love is that, if you have type 2 diabetes or have a loved one with type 2 diabetes, know that there is a better treatment option out there than having to take injections. And that's through Omnipod 5. It's available today through your pharmacy benefit, including Medicare Part D. The majority of our patients pay less than $50 out of pocket per month for their pods, and actually a third of patients pay nothing. And so really affordable therapy that's available today. You should talk to your doctor about it, and also come to our website, omnipod.com, for safety information.
Doctor, you know what's interesting to me? Let's talk a little bit about the advances in medicine. You always talk about innovation and everything that's going on. Talk a little bit about the advances, especially in this new system.
Yeah, so it's James, it's like unlike anything that's on the market previously. So, today the majority of patients have to take injections, and it's just so hard to manage their diabetes. And so actually this technology has been around for probably about at least 15 years, and it's been primarily used by people living with type 1 diabetes. So actually today, over 425,000 people around the world already use this product. But recently, Insulet obtained FDA clearance for the Omnipod 5 to be used in type 2 diabetes specifically. And so we see enormous potential for this technology to be beneficial and help so many people living with type 2 diabetes today who are not getting all the injections that they need.
15 years. That's amazing. It's truly amazing. Doctor, thank you so much for joining us on Morning Blend.
Thanks, James.